My name is Cathy Gumtow. I live in Suffolk, Virginia, and my doctor is Dr. Haynes. When this all started for me 7 or 8 years ago, I did gel, cortisone shots, creams and ointments and pain pills, and basically just nursed things along. I had a lot of pain. Getting through work was difficult without help with pain relievers. But what I was doing was limiting myself in my activities because it hurt to walk, it hurt to move. Going to the beach was not fun anymore. Going shopping for an extended period of time was not fun anymore. Last January, I was working one night and the left knee went out and I couldn't put any pressure on it, couldn't walk. It scared me. You can't even get up and walk to the car at that point. What concerns that I have as a nurse, worried about infection, of course, worried about complications from surgery because, again, as a nurse, you know all the worst case scenarios. And he was able to just ease my mind on all of that. One of the more interesting things that he said was he wanted to do it as an outpatient, which I would have never thought was possible. But I was a 7:30 case, and I was home at 12:30 in my bed. It was great. He's obviously a brilliant surgeon. He's a funny man, always available to answer questions. He called the night after surgery, called home to check on me. The first night I went back to work, I walked from the parking lot into work and I realized, hey, I'm not hurting. And I told Dr. Haynes this one time. I said, now I kick myself because I waited so long. I started riding my bike again. I can walk my dogs. I went shopping with my sister the other week up to Williamsburg. Now I can do things around my house, and I like to garden, and I might even go back to mowing the lawn, I don't know.